open enrollment is going on right now through December 1st for people 65 years of age and wiser. Dr. Kristi Clark, Medical Director for Health Texas, is here with what you need to know about Medicare and open enrollment. Thank you so much for being here, because this is a topic I'm sure a lot of folks have questions about.
Absolutely. It's good to be back. It's a very stressful time for patients, and not, you mentioned 65 and wiser, but not just those patients. Anyone who has Medicare, this can be a really stressful time for them.
And during this time, we want to give our viewers an opportunity to address some of these concerns. So let's take a look at our first question, because it's from Twitter.
Okay.
Why are fewer doctors accepting just traditional Medicare?
You would think that the answer would be simple, but Medicare doesn't pay very well, reimbursement. But actually, one of the main reason that many physicians have turned away from Medicare is because there's been an increasing complication. It's just complicated. Just like it is for patients, it's complicated for doctors as well. They have to submit a tremendous amount of data, and because of that, a lot of infrastructure and employees go in. So many physicians have kind of shied away from Medicare because it is complicated. But that being said, I think it's really important to know that San Antonio still has a very high penetrance of Medicare, and most docs in San Antonio know it's a vital part of a practice. So in San Antonio, we're pretty safe. Most docs still take Medicare.
Which is good to know.
It's great
That is good news to know. Our next question comes from Facebook, and it is, what are the different types of Medicare? Because we know there's a few.
It's very confusing. I think the government thought it would be simple if they named things A, B, C, and D, but it's really not.
Right.
So I'll just tell you real briefly. So Medicare Part A really is about hospital benefits, and that's where the bulk of the bulk of the expenses are. Medicare B is what we traditionally think of with our premium. That's when you go to see your doctor, when you go to see your specialist, things like canes, walkers, anything that's in an outpatient setting. I'm going to skip Medicare C for just a minute. Okay. Medicare D is drug coverage. When you go to a pharmacy, when you have a prescription benefit, that's really what Medicare D is. Medicare C came in 1997 after the Balanced Budget Act, and it allows a private insurer to basically offer a product that combines A, B, and D. So C is kind of a combination of A, B, and D, what's called a Medicare Advantage plan.
I see. And on that note, our last question, if we can get it up on the screen, why should someone who's on Medicare join a Medicare Advantage plan?
It's a great question. It's a common question. So a Medicare Advantage plan, one reason is just simplicity. You don't have to worry about picking the right A, B, and D. You just get it all packaged together in Part C. That's really easy. Cost is huge for patients. And with the Medicare Advantage plan, almost always will save patients money. They have co-pays rather than co-premiums, to where you don't pay quite as much when you go to visit the doctor. You have a copay. Also, there's out-of-pocket expenses that actually have annual limits, so you don't have as much long-term expense if you have a lot of chronic medical illnesses, and the premium can be lower. And then for people who are on a fixed income may find that they do better with a lower premium, so they go to a Medicare Advantage plan, have more to live on month to month. And then I think finally, a lot of patients with Medicare pick a Medicare Advantage plan for what are called the extras, or the added benefits. And these are things that typically Medicare doesn't cover. And we think that Medicare covers everything, but that's really not the case at all. So Medicare does not cover things like dental insurance, or vision insurance, or perhaps hearing aids, transportation, gym memberships, maybe wellness programs. So a Medicare Advantage plan bundles a lot of those kind of perks or pluses, if you will, into their Medicare Advantage plan, kind of a perk for patients. So in addition to your A and your B and your D, you're also getting some added benefits that otherwise you wouldn't have, or you'd be paying out of pocket. And I think that's probably the main reason a lot of folks will join these programs. And they're good programs.
Right, and it could help just alleviate the need for a supplement.
Absolutely, absolutely.
Okay, real quickly before we go, if someone is just starting to delve into this, what are some common mistakes they might make when looking at?
I think so a Medicare Advantage plan works great for almost anyone. I would say the only people it doesn't work well for are people who really travel a lot, because remember, a Medicare Advantage plan really just stays locally. So if you're a person who travels across the country, to visit kids or relatives, and you're out of the San Antonio area for a long period of time, that's probably not the best plan for you. But otherwise, I think patients do wonderfully on Medicare Advantage plans. It's simple, it's less cost, and there's a lot of value-added benefits to it as well.
All right, Dr. Kristi Clark, thank you so much for all that information. And for more, just head to HealthTexas.org. That's HealthTexas.org for more information on Health Texas, or give them a call at 731-HTMG. That's 731-HTMG.